I'd like to start this session 4 of broad spectrum health CSR addressing diverse diseases for holistic community care. And I would like to start with Shri Sanjay Kumar Sir, Chairman and Managing Director of RailTel Corporation of India, one of the largest large rail corporations, and who is, I'm very sure, they do a lot of CSR work also, but more than that, more than the exact CSR fund, I think what more powerful they have is their whole infrastructure, network, technology, people, and that access to people across the country. Penetration, that is, I think, which is more important. So my question to Sanjay sir would be that, given the vast reach of RailTel's network, how can digital innovation be leveraged to improve access to healthcare services, particularly in remote and underdeserved areas? Can you share specific examples of CSR initiatives using technology, or any other CSR initiatives your organization where you have been at the forefront, and any learnings from those initiatives done by your organizations?
Thank you, Dr. Sadeep. In fact, very good afternoon, and this session is coming between us and lunch. So I would like to be very brief. In fact, a very good opening note addressed by Jiten Sharma. The idea has to be the idea has to be funded by CSR. So, in fact, technology is the guiding force today, and more than that, the new somebody may say jargons, but those are now the real words and reality. Like when I used to study artificial intelligence, there was a para in a book when I did my graduation. So artificial intelligence, there was a para only. Now it is a reality, and artificial intelligence can really be a technology drive which can help us mitigate the gap between the digital gap which is there between urban and rural areas of the country. Most of the India lives in countryside. So भारत और इंडिया के बीच का जो गैप है, actually this is the basic challenge of health sector and of course in education sector also. So in health sector, there's a acute shortage of doctors, qualified doctors. There's a health literacy is not there. Patients don't know where to go, what to do, and how to do. And there are many other undesired factors also in the tier 2, tier 3 towns, which actually prevent those patients reach the right kind of place. So I think CSR initiatives should focus more on these and find out ideas, of course, as Dr. Jiten rightly pointed out, that how to bring them on board, because all of them can't visit Delhi or Lucknow or Jaipur or any such place where world-class or maybe not world-class, even desired level of medical health facilities are available. So then one technology solution, it has been there for quite some time, that was telemedicine, which is a technology product. Telemedicine is being popularized, but still there are lot many gaps. Second would be, I think, the skilling the people, because in rural areas, if qualified doctors, practitioners are not there, at least the local people, through telemedicine, if they are educated properly, they can help the doctor sitting at the remote comprehend the problem with the patient. As rightly somebody pointed out in the last session, that there has to be a person, because the rural area people, they know only their language. उनको हिंदी भी ठीक से नहीं आती है, उनको सिर्फ अपनी डायलेक्ट आती है, उनके अपनी भाषा में उनके मर्ज को समझने वाला अगर वहाँ पर बैठा है और वो डॉक्टर के साथ कम्युनिकेट करके प्रॉब्लम को राइट पॉइंट ऑफ टाइम में इफ़ ही इज़ एबल टू send it the right kind of message to the doctor so that he can be treated properly. Similarly, I think nowadays there are devices which can monitor the basic parameters sitting remotely. The patient is remote and the doctor sitting remotely can actually see the basics. Maybe even ECG also, I think the devices are available, and AMTZ is a place where such innovations keep happening. In fact, I would like to share one, Dr. Jiten Sharma in fact told me. So the cloud inside the AMTZ campus has been created by Railtel. It is funded by Railtel. So yeah, and data center also. So we are doing lot many things and trying to do. We are a very small company, so we have very small budget, but we try to spend most of our CSR funds in health sector, hygiene, like menstrual hygiene is major issue, and most of the cancer diseases when they come in, like they are there in rural areas which are undetected and the patients are dying. Then cancer survivor patients, similarly even other diseases also. Somebody rightly pointed out again in the last session that 50% of your disease goes away if somebody is consoled in a right manner, that what is it and what does it mean to him, and it can be cured and how and so on and so forth. So technology, of course, with the use of, like, similarly another example would be like clinical decision support system. So if a patient through some ABSS scheme or whatever government schemes are coming up, if a patient's complete database is maintained and maybe one drug is prescribed to him, so it is ensured that that kind of drug is not affecting that patient in some other disease which he is already suffering from or likely to suffer in near future because of some other reasons, whatever. So those kind of clinical decision support systems, once they learn on large language models, large databases, they will also really will help us in developing our disease into complexity. So sometimes we don't know something else is also happening inside our body, but we are getting cured with one disease, some other disease is getting incubated. So this kind of technological inputs and innovations, of course, will be required, and this rural and urban digital divide, with the help of telemedicine kind of initiatives, which are though they are in the area, in the country, but hardly being practically available. Maybe in urban areas we are using it, but in rural areas hardly any penetration. Railtel being we have our network along the railway track, so we cover around 1 lakh village panchayats out of 2.5 lakh total village panchayats. Railtel covers about 1 lakh panchayats, and out of that about 17,000 we have already connected through our network. They are connected, we are providing broadband facilities also. So such telemedicine facilities or similar other communication networks can be used to proliferate medical advices, even other innovative initiatives which are taken in future. But RailTel can only be a medium. Of course, it cannot happen without health ambassadors, our qualified doctors, and of course the supporting team sitting at the remote in the rural areas. So they have to be trained. I think unless they are trained, this rural and digital divide cannot be bridged. So thank you very much. This much I want to say. Thank you.
Thank you, sir. Really insightful, sir. So, RailTel is already using the blend of technology and the healthcare doctor and the medical skills for their CSR. That's wonderful to know. So, I would move on to the real doctor, Dr. Nilesh Tiwari, one of the leading psychiatrists of the country. He runs Word Brain Center, very popular brain psychiatry hospital. And mental health has definitely been at the center of discussion in healthcare, particularly during COVID, post-COVID, and it has come into limelight. And it is, but unfortunately, it is often overlooked in holistic healthcare. So, how do you think can CSR initiatives be designed to raise awareness about mental health issues and provide accessible support services? Can you discuss the importance of integrating mental health services into community-based healthcare programs? And given the fact that a lot of celebs themselves have come forward to actually pitch in and bring support this cause of mental health issues. So, what is your view, Dr. Tiwari?
Yeah, hi. A very good afternoon to all of you. And today is Teachers' Day, and I'm really so lucky and privileged. Dr. Nimesh Desai is here. Sir, are you here?
He's going to join in a while.
No, I saw him. Yeah. So before I start, I would like to pay my gratitude to Dr. Nimesh Desai. He is my teacher. So I'm so lucky to see him over here. So I'm really blessed. What Dr. Swadeep is telling, that mental illnesses, they are often overlooked. That's very true. And reason behind this is very simple to Sir, Happy Teachers Day, Pranam. Before I started, आपको मैंने प्रणाम किया.
Dr. Nimesh Desai.
Dr. Nimesh Desai, sir, आपको प्रणाम. I'm so blessed. My teacher is here on Teachers' Day. So I was telling that mental illnesses are overlooked often, and there is a very, I'll say, lucid reason for this. Like physical illnesses, injuries, fracture, it is obvious, it is seen. Mental illnesses are not seen. But let me tell you, as a psychiatrist, I can vouch upon this particular statement, that these mental illnesses or these psychological injuries, they are much more chronic and much more severe. So this is the reason why it is often overlooked. Second point, what Dr. Swadeep was asking, that how we would be able to understand these illnesses and how we can rope in NGOs and all. So let me tell you a very surprising thing. Most of the people sitting over here are not aware about the prevalence of these illnesses. There was a study, national survey done in 2015-16 says that 15% of Indian adults, they require some sort of active mental health intervention at particular time. 15%. And this study was done in way back 15-16. So now after COVID, you guys can understand, because there is a steep rise after COVID. 18% increase in depressive disorders, 15% increase in anxiety disorders, around 30% increase in obsessive compulsive spectrum disorders. So now we can understand what is the real prevalence of these disorders. But the problem is a stigma. Mental health is having the biggest problem, which is a stigma. We can treat illnesses, we have wonderful medicines, therapies are available, everything is available. But stigma is the biggest problem, and that is the biggest hurdle in treating mental disorders. I'll tell you a very interesting story. I diagnosed a patient. I told him, look sir, you have depression. तो मैंने इसको अपने इंस्टा पे भी डाला था, बिकॉज यूज इंस्टाग्राम आई डोंट यूज ऑफन, बट इतना इंटरेस्टिंग था वो कि वो मुझसे कहता, क्या मुझे क्यों डिप्रेशन होगा. मुझे वो अमिताभ बच्चन का स्टाइल याद आ गया कि मेरे पास बैंक है, बैलेंस है, कपड़ा है, पैसा है, दौलत है, मुझे क्यों डिप्रेशन होगा। मैंने कहा सर आपके पास सेरोटोनिन कम है। सो आई मेड हिम अंडरस्टैंड मैन, depression is not because of your economic status or your social status, anything. It can happen to anyone anytime. Like Deepika Padukone, she herself expressed that she is having depression recently. A lot of other people, they are exposing and they are telling that they have depression. So I told him that look, the problem is with 5-hydroxytryptamine, serotonin, that is less in your brain. So that's why you have depression. So that is the message which I really want to give through this forum, that please try to understand these mental illnesses are not just because of your psychosocial circumstances or maybe your environmental problems or family problems or occupational problems. It is something which is biological. If your hormones are coming down, if your neurochemicals are getting their equilibrium is missed, you're going to have these problems. So try to understand. Because after stigma, I'll be talking about acceptance. Because acceptance is second challenge in mental illness. People don't accept. Even if you'll tell them that you have depression or you have OCD or something, then they'll be going to some other psychiatrist. They'll be saying, उन डॉक्टर साहब ने तो हमें डिप्रेशन बताया था, आप देख के बताइए, हमें नहीं लगता मुझे. So they will start with this note because they are making the psychiatrist or the therapist biased right from the beginning. Because they just want to validate their notion they don't have this thing. So acceptance is second most important problem, and this happens with parents most of the time. When you tell their child that they have some sort of disorder, some sort of problem, parents will often say हमने कौन सी गलती कर दी, पूरा टाइम दिया, इसने तो अपना जॉब भी छोड़ दिया, और साहब इसको कैसे डिप्रेशन हो जाएगा. तो उनको फिर वही बायोलॉजिकल मॉडल समझाना पड़ता है कि सेरोटोनिन कम है. So that is what I just want to convey. Next, Dr. Sudeep was asking that how we would be able to, rope in NGOs and all. So let me tell you, first of all, we need to understand the magnitude of problem. Once you are able to understand the magnitude, then only you would be able to really think that it is a serious mission and we need to join hands and do ASAP. Like cardiac problems, they'll start usually after 40 years or 50 years. Like respiratory problems, COPD, they'll be starting in people who have bronchial asthma, but usually they have some age, mostly around 40, 45. Similarly, if you talk about gastric problems, pancreatic problems, so there is kind of an age where they peak. But let me tell you about mental illnesses. As the child is born, he may be prone to hypoxic brain injury. He may have mental retardation. Then as he grows, there is a possibility of pervasive development disorders, autism, ADHD, then childhood disintegrative psychosis. Then as he grows, he may have behavioral problems, oppositional defiant disorders, conduct disorders. So psychiatric illnesses they really go hand in hand, and so many times you'll not get to know, you'll start suffering from it. Then as you grow, adolescence problems, then of course teenage, then nowadays in Delhi, relationship problems. In Delhi, breakups are biggest problems. Oh sir, Delhi is heading. After Delhi, of course, Andhra Pradesh is on second number. So teenage problems, then of course once a child maybe he goes to college, then adaptation in college, then ragging, then lot of negativity, so that can also lead to problems. Even if I'm seeing a lot of IITians or a lot of very bright students, but they are good in maths, they are good in science, but they are not good in understanding the law of nature, law of sociability, and they often fall prey to all these things. After maybe someone completes his graduation, post-graduation and joins MNC, then again a big problem. There was a study done by McKinsey, I think in 2022, which says every third person in a multinational company is having kind of anxiety or depressed symptoms. and he is stressed. Every third person, every third. So you can understand psychiatric illnesses, psychiatric derailments, they are always there in your life. Then as you grow up, you may have schizophrenia, depression, a lot of other disorders. Then of course, I'll like to enumerate many others, but since lunch is ready, I think, so I'll go directly to geriatric problems, which is a serious problem these days. Dementia. On this platform, I would like to draw your attention that dementia is growing like anything in India. There was a time when I was in Ibhas and under Dr. Nimesh Desai. So I used to see around 3-4 cases, right sir? 3 to 4 cases of dementia every month, I believe. And nowadays I am seeing at least 2 to 3 new cases of dementia every day. Every day. So it is growing like anything, and we need to make sure that we should start providing whatever we can do for degenerative brain disorders.
Now coming to, we have a leading scientist among us, Dr. Ashu Grover ma'am. Everybody knows the type of work she's doing at ICMR, and medical research is always even quoted by our Prime Minister, how we lack in a big way in medical research, original medical research in India, and that's one area where there is a great need for all type of attention, not only CSR focus, the funding, but even various other scientists coming forward, joining hands, various different stakeholders coming forward, and promoting medical research in India. So, Dr. Grover, what would be your view?
Good afternoon, everybody. And first of all, thank you, Dr. Swadeep Srivastava and the whole HEAL Foundation, through which we have come together. And I think just one thing I would like to start my conversation on that this is a fora where not only the medical professionals, we have the whole lot of academicians from the industry, from the regulatory bodies, from the non-government organizations, from the government organizations. They all have come together to discuss that what we started with Dr. Jitendra, that's an idea, right? So everybody may have an idea, but to carry forward that idea, we definitely need a platform, and this is the platform. And I'll say just one step ahead of that, when Dr. Jitendra said that it's the beginning, I'll say that this idea and this CSR summit is going to be beyond national boundaries as well, and the day will come that when we'll have an international platform as well on our board, because there are many funding agencies who are ready to give to and support this cause. As an epidemiologist, I would like to say that yes, we cannot disconnect from human health from rest of the factors. When we talk about rest of the factors, we say that yes, it's not only the body, it's affected by the environment, it's affected by the interaction, how the society behaves, physical environment, the societal environment, and the natural environment. So when we talk about from the research per se, I belong to Indian Council of Medical Research, and I'm there for last maybe 2.5 decades. What I have seen that when we say that yes, research in our country is not at par as the other developed countries we have at the tune of the National Institutes of Health or the MRC or the Netherlands and Australian agencies. But yes, there are certain landmark achievements which country has got, and it's given to the world, like we talk about very proudly that some of the vaccines which have come out of the research and the diarrheal treatment and tuberculosis treatment. But I would not like to, take those as success stories, because the era is changing. We need to come back to the revolutionary, achievements and the developments which have been happening, not only for the management of the infectious diseases, but for our non-communicable diseases, and right from the reproductive and maternal child health. As a human being, we cannot disconnect that, okay, this is a communicable disease, this is a non-communicable disease, this is a nutrition or like. So we at ICMR, definitely we work in collaboration, which we, rightly believe in that. So Indian Council of Medical Research has been working very closely with the research institutions, and one of the institutions are here. We have the INAS, we have the AMTZ, we have the Dental Council of India, Dr. Kohli is here, the past president, and many other organizations must be sitting here. So that I say that one, we have to idea and determination, we need to have the collaboration. Collaboration is the key. Whether we want to collaborate for a treatment of illness with the Ministry of Ayush, or with the Ministry of MIT for IT development, or many such agencies. Now, what CSR can do, I'll just take one small example here. That 2 months ago, Indian Council of Medical Research has also started thinking of how to invest the money from the CSR component from the various organizations, and the first meeting was held 2 months ago, and we are having another meeting on 30th of this month again. The only issue that most of the CSR agencies are ready to provide funding to the cause of health research and for alleviation of the diseases as well, but we do not have the regulatory procedures. So when we talk, they tell us how to give the money. Should we directly give it to ICMR pocket, or should we directly give it to the state health authorities? So we really need to carve out some, maybe this is the summit, this is the channel, this is the platform, with the help from AMTZ, they're really susceptible about that. How do we transfer the money? The whole question, we have the Bharat Petroleum, we have the Indian Oils, we have the other pharmaceutical companies also. All only question was that how do we give the money to the cause of medical research? So I think this is one idea. Again, I float on this platform that could we come up some of the regulatory frameworks through this summit, that yes, this is the channel, and advise the government bodies that how you can take the money from the CSR component. And another issue comes about the prioritization. Should we work on mental health? Should we work on infants? Should we work on menstrual hygiene? Or should we work on diabetes, hypertension? It's all issues of the prioritization. So for that matter, we need to identify that who is working on what areas. For example, AMTZ is working on all manufacturing, medical devices, regulatory. We did not have any agency in India. Trust me, I think this is the first body in India, and probably it is first body in the globe, which has one thing under one roof, that it has regulatory structures, the marketing, the manufacturing, and all the procedures, and to the finest of all the process. There is no deviation from the rules and procedures and all that. So I think many companies would like to go to the AMTZ, and we need many more AMTZ. I am requesting, sir, many times that let it make it as a national center and then a global center for further training of the other institutions also, and they should have the regional hubs across. So I will stop here. There are many things I had noted, but in the interest of the time and getting a hint from Dr. Kohli that please keep it minimum. So, so thank you so much for inviting me to this platform, and I look forward for the CSR meeting which is planned on 30th of September, and I wish that there will be some procedures which will be laid down during that meeting. Thank you, Swadeep.
Thank you, ma'am. Very important point you raised, ma'am, that today in the morning session we had Mr. Mukesh ji, the director of Indian Institute of Corporate Affairs, who are very deeply involved into creating guidelines and the CSR impact programs, how they do with the corporates and the PSUs. So of course we can bring all of them together, and as Dr. Jiten Sharma said, that now we have to create an idea bank. So I think the idea bank can start from here by connecting the dots. But one of the pertinent issues which I would like to go to Dr. Kohli also, and then come to Dr. Sharma as well as Dr. Tiwari, is that while we were talking about, and I was listening to Anshu Grover ma'am, so when we talk of medical health research, so this is one module which is globally quite successful. If you look at US in terms of the Stanfords to any other top institutes there, even Harvard, Massachusetts, everywhere, there's a lot of philanthropy, CSR support which goes into these institutes in a very organized way, and that's why there's a lot of initiatives of medical research which have been very successful, and that's why they rule, in fact they rule the world because of their original medical and health research, what they have been doing in terms of bring out new drugs, innovations, technology, everything. If you're sitting in India, we can boast of many things, but one of the fact is that still majority of innovation is done in US and other developed countries. So Dr. Kohli sir, you have been at the helm, you have seen the healthcare from both ends. One is at the bottom of the pyramid where you do your own CSR, oral health programs, campaigns. At the top of the pyramid, sitting with the treating the dental problem of a Prime Minister of India. So he's sitting on the mouth of the Prime Minister of India for so many years. So
Good afternoon, everybody. I'll take few minutes, not very long, because this is between the distance between me and the lunch. This morning I was at a conclave, the roadmap to the Viksit Bharat 2047, where the health minister was there, and then Dr. Sareen was there, and Dr. Guleria was there, and myself was there. And very interesting thing came. And when I came here, I was to come at 11:30, but somehow I came at 12:30. Now also I have to run. 5 people are waiting in my clinic for the appointments. Now, listening to Jitendra, what he was talking about the ideas. Now, we do invest in new ventures. We talk about the startups. But many people, as he rightly said, have very good ideas, but they don't have the funding or they don't have the facilities because they are at the remote places and other things. So there are quite a few things which I summarize when we talk about the health of a nation or health of a person. There are 4 things. They are all 4 A's which can solve many of the problems. Like you take awareness. The awareness has to be brought into the society about many things. Because with the changing lifestyle, many diseases are increasing every day. And awareness can be brought by people like Sudipto, people like media, people like us, people sitting at the regulatory body, and more than anybody else, the political people. Political will has to be there. Then second A comes availability. How the things are available at the grassroots. And how people can reach, that is the best way, as I was telling about the telemedicine, which is the next AI and all those things are there. Then is the accessibility. How accessible are these things? Now, this morning, Minister was talking about a card where all health data will be there, where you have all the data of the practitioner of the medical fraternity and everything. And the last is the affordability. How affordable is the things? And like we talk about generic medicine, because this morning they were talking violence against the doctor, they were talking about gender bias. All these things have to be addressed. Apart from that, we have a population of 144 billion. For that population, the minister was telling, we have increased the seat from 50,000 to 1 lakh. We have increased the medical college from 350 to 700. They are planning for 1,000. And the quality and all. But when you talk about the availability and the cost of the things involved in that, take an example. How much money I spent to become a doctor from a government King George's Medical College? Total money spent is 1,200 rupees, 300 rupees per annum. And look at today, people have to pay crores to become a doctor. I'm talking about 70s, late, yeah. But today, so the best of the minds which can achieve the merit, they don't have the money to spend. The people, those who have money, they don't have the numbers. So there's a quality is a big issue. Coming back to that, about the machines, like you were talking about the machines and best things being used in the medical field, CAT scan and all those things, and MRIs and other things being Indianized, and prices are one-tenth of the thing. So we have to promote Made in India, make people aware, and do on the preventive side so that we can be a healthy nation. Thank you very much.
Thank you. I think the lunch is sitting on our head. We have to cut it short, and taking the idea from Dr. Jiten Sharma, from all the panelists, that we have to work towards creating an idea bank. Most importantly, connecting the dots in CSR. I think that's one of the most important things which needs to happen. A lot of people on the funding side are thinking of doing a lot of CSR work. A lot of people on the NGO side are ready to do a different set of programs on the ground, but there is a gap, there is no connect. Even technology is also not being used properly in CSR. So connecting the gaps which can start with the idea banks. Thank you so much. Thank you everyone.